welcome Miss Allie with the Mesa Chamber of Commerce. And again, I think I've said this every call. I love seeing you guys. It's just so much fun to see you. And of course, we'd rather be in person, but thankfully we still have Zoom, right? And again, I'm glad that you're all on the call and you all look well. And, it's just, yeah, it's been almost a year. Hard to imagine. I think our last in person was March of last year. So good to see you. And I'm going to turn it over to, I know she's on here, but I don't see her. Lauren, where are you? Oh,
I'm
there
here.
you are. Okay. Turn it over to Lauren, our chair.
Well, welcome, ladies. Good afternoon. Welcome to the Rouiter-Business Council. Can you guys hear me okay? Okay, good. So today we're welcoming Miss Allie Rouiter. She is the Business Development Director with the American Heart Association of Greater Phoenix with a focus on Heart Challenge. Previously, she was with the American Cancer Society working on community development and Relay for Life. She is new to Arizona and enjoying exploring this great state. She currently lives in Scottsdale with her husband, daughter, and their dog, Jax. So Allie, thanks so much for joining us today, and take it away.
Hey, Allie, can you just for a second, please?
Yeah, of course.
Lauren's so excited, but before we have you speak, I'd like to just give a little bit of time to our sponsor today, Jan.
Yes.
We're going to have you hold just for a moment. Jan?
Okay, well, thank you. I'm sorry about that. I'll make it really quick, Allie. I can't wait to hear from your organization. I'm a strong supporter of what you guys do. So thank you so much. So I love Valentine's Day. I was even married once. One of my marriages was on Valentine's Day. It did not work out, but I did find another wonderful man, and we were not married on Valentine's Day. But anyway, Valentine's Day is a great occasion to celebrate just so many things, your friends, your family. For us, we provide our staff with little gifts on Valentine's Day because, it signifies love and gratitude. And so at Nothing But Cakes, I just wanted to show you a little bit about what we have for Valentine's Day coming up. This is our Love You to Pieces cake. And you'll see that this says, "You complete me." It's really adorable. This is our wonderful red velvet that has chocolate chips in the red velvet. These are our buntinis, and these are sold by the dozen. And these are adorable little love toppers. And all of our buntinis, for each season, we do have different toppers to complement each season, and they're absolutely adorable. We are always coming up with creative ideas for our decorations. So we do have, for all of you realtors out there, we have a realtor cake coming up. We have a doctor cake, a nurse cake. So we've got so many things coming down the pike, and a darling Cinco de Mayo cake, which is really, really cute. Also, for those of you who are looking to give a fun gift for clients or your staffs, we have what are called Gauntlet Towers. And we wrap 1, 2, or 3 buntlets in these with cello wrap. We have a custom card that we can put your logo on if you'd like, and a custom message. So these are great for all of your clients to go out and actually have your logo on. We do these for a lot of people. And also these little sentiment flags right here, so they can say, "Happy Valentine's Day, thinking of you, I love you, just because." So many fun things. So I want to thank you all for supporting our bakery now and always, especially during the challenging time that we've had with COVID. We have kept our doors open, and we are so thankful to all of you in Mesa and Gilbert and in the East Valley. We were fortunate to win the 2020 Best of the Best Dessert and Bakery for the East Valley Tribune through all of this. So we are so grateful for all of you. And I want you to know that we have a special little gift for 2 of you today. We are going to award 2 of the members today on this call with a Buntlet a Month for a Year card. These are valued at $60 each. So these would be fun. If you don't want it, I'm sure someone you love would want it for Valentine's Day. So thank you again. And I encourage all of you to support the Chamber by being sponsors of these wonderful Zoom calls that we have. It's so much fun and does so much, and we learn so much. So thank you very much. And we look forward to seeing you at Nothing But Cakes, Gilbert Mesa. Thank you.
you, Jan. Always good to have you joining us. I appreciate it. Jan's also one of our board members, and well, that makes for one of my bosses. So thank you for being so good to all of us. All right, Allie, it's without further ado, we'll turn it over to you, and I will share my screen because I'm guessing that you might have some slides to share.
I do. Yes, I have slides to share.
All
And
right.
I just want to say, Jan, I absolutely love nothing but cakes. It's a tradition. My husband gets me one every year for my birthday, the red velvet one, and it's absolutely my favorite. So I'll be sending him to you. My birthday is actually on February 8th, so hopefully you'll see him soon.
Guess what? My husband's birthday is on February 8th.
No way. That's awesome. It's a good birthday.
Thank you so much, Allie.
Yes, thank you. Okay, go ahead and share my screen. Can you everybody see it? Yes? Okay, great. So I just want to say thank you for having me today. My name is Allie Routier. I work for the American Heart Association Greater Phoenix, and I am so thankful to be able to share this information I have for you on the work that our association is doing, specifically around women and our community and workforces. And as we go through, if you have any questions or comments, please let me know. I can't see the chat box, so if someone else wants to let me know if there's any questions in there, please do. So the American Heart Association, we are the nation's oldest and largest voluntary organization dedicated to heart disease and stroke. We were founded in 1924 by 6 cardiologists, and it has grown now to be over 40 million volunteers and supporters strong. And our mission is to be a relentless force for a world of longer, healthier lives. And we work to improve the health of Americans in a variety of ways. We're the nation's leader in CPR education and training. We help people understand the importance of healthy lifestyle choices. We provide science-based treatment guidelines for healthcare professionals to help them give quality care to all of their patients. We also educate lawmakers, policymakers, and the public as we advocate for changes to improve the health of our communities. And we work with many diverse partners across many different sectors to build a culture of health for everybody. We have volunteer experts that select scientific research worthy of funding. And thanks to our generous donors, we have actually invested more than $4 billion into research, which is more than any organization outside of the federal government. We've funded 13 Nobel Prize winners and many life-saving research advances, such as the first artificial heart valve, cholesterol-lowering drugs, heart transplantation, and CPR techniques. But with all of this work that we have done and continue to do, heart disease is still the #1 killer of Americans and throughout the world. And stroke is the #5 killer here in America and #2 globally. And I hope that after this presentation today, you'll see the impact that you can make and join the fight to improve health and save lives. And so I just have a question for all of you, and you can pop your answers into the chat box, or if you want to come off mute real quick and share. But I just want you all to think about, have you ever had a family member or a friend or you yourself that's been impacted by heart disease or stroke? You know, knowing that it's the #1 killer worldwide and stroke is #2 worldwide, I think it's fair to say that almost all of us have been affected by this. And does anyone want to share a story real quick before we move on?
I'll share.
Yeah.
I really think I should probably have a zipper installed in my chest because just so people can get in and out of me, because my parents both had heart issues, and again, as I said, I've always been a contributor to the American Heart Association, and so grateful for the efforts that you do as far as research. My mother actually passed away from an aortic dissection, and my father had a valve and had 4 bypass surgeries. So we're forever grateful for all that you do, and it's very important to me to keep this up with making sure that you're on the cutting edge of research.
Right. Thank you, Jan, for sharing. I think it's important for us to hear those personal stories as we go through this, because it really connects you to why it's so important we do the work that we do. And I'll share my own story. My daughter was born with 2 congenital heart defects. She's okay now, but it was really scary when she was first born. My grandfather passed away from heart disease, and my aunt at a young age had an aneurysm resulting in a stroke. And so, I'm a staff member here at the American Heart Association, but I'm also a volunteer and supporter myself of the mission. So moving on, we need your support. We need the support of our community stakeholders, our community leaders, of our company leaders, and really everybody throughout this country and the world. We know that every 40 seconds, someone has a heart attack or stroke. And each year, nearly 800,000 people experience a new or recurring stroke. And to help you visualize how many people that actually is, it would fill State Farm Stadium 12.5 times. We know that right now, currently in the US, 1 in 3 Americans have some form of cardiovascular disease. And here in Maricopa County alone, nearly 2 million adults are currently living with high blood pressure. Only, about half of them are being treated for it. And that's scary because we refer to high blood pressure as the nation's silent killer. So here are some more facts about heart disease. It is the #1 cause of death in the United States and throughout the world. In fact, 1 out of every 3 deaths in our country today is caused by heart disease or stroke. And while heart disease is the #1 cause of death, most people do not think that they are at risk. The truth is that heart disease is preventable in most cases if we make those healthy choices. But 83% of people believe that heart attacks and strokes can be prevented and are not motivated to do anything about it. 72% of Americans do not consider themselves at risk for heart disease, and 58% of people put no effort into improving their heart health. On the flip side, every year about 785,000 Americans will have their first heart attack, and 470,000 will have another. And it actually affects more people every year than the entire populations of Mesa, Chandler, Gilbert, and Tempe combined. So it's obvious, you can see there is a disconnect between knowing we need to be healthy and taking that action to do it. So just to share some facts about stroke, it's the #5 cause of death here in this country, in the US, and it is also our #1 debilitating disease. And unlike heart disease, people aren't as familiar with what stroke actually is. So stroke is an interruption of blood flow to the brain, and without that oxygen-rich blood, brain cells begin to die. Most strokes are called ischemic strokes, and these occur when a clot or mass blocks a blood vessel, which cuts off blood flow to a part of the brain. And then there are also hemorrhagic strokes, and they occur when a weakened blood vessel, like an aneurysm, ruptures and spills blood into the brain. We know that immediate medical treatment can save lives, but more than 1/3 of acute stroke patients do not take an ambulance to the hospital. They're not calling 911. And that's why the American Stroke Association, which is our sister organization, works specifically to educate the public on the importance of spotting a stroke using the acronym FAST. So FAST stands for face drooping. So you ask the question, does one side of the face droop or is it numb? Arm weakness, is one arm weak or numb or tingling? And so you ask the person to raise both arms, and do you see one arm drift downward? Speech difficulty, is speech slurred? Are they unable to speak or hard to understand? Ask the person to repeat a simple sentence, and is that repeated back to you correctly? And T stands for time to call 911. So if a person experiences or shows any of these symptoms, even if they have gone away, it is so important to call 911 and get this person to the hospital immediately. Knowing that 800,000 strokes occur in the US each year, it is so important to know how to spot the signs of a stroke. So before we move on into some statistics specifically involving women, quick trivia question. Do you know what the #1 cause of death is for women? And you can just pop your answer to the chat box. Is it A, breast cancer, B, heart disease, C, stroke, or D, ovarian cancer? So if you chose B, heart disease, you would be right. It is the #1 cause of death in women. I always like to show this graphic here because it is important for women to know that a female may experience less obvious warning signs of a heart attack than a man. So the signs and symptoms for a woman having a heart attack is nausea or vomiting, jaw, neck, or upper back pain, chest pain, but not always. Not all women experience chest pain if they're experiencing a heart attack. And then pain or pressure in the lower chest or upper abdomen. So my mother-in-law actually had a mild heart attack earlier this year, and she had no idea it was happening. She thought she just had indigestion and was just feeling off and weird. And thankfully, a friend of hers had stopped by her home on a walk. It was one of her neighbors, and she knew the signs and symptoms of a heart attack and was able to rush her to the hospital. But if she hadn't had that friend stop by, who knows what would have happened? It's really scary. So it's very important to know the difference of a heart attack between a man and a woman. So we know that women are at risk for cardiovascular disease. Among women aged 20 and older, nearly half have some form of cardiovascular disease. And so that's more than 56 million women in the United States, or the populations of every state here in red. We know that 43% of Hispanic women are living with cardiovascular disease, 57% of Black women, and 43% of white women. And here is some information on women's heart health by the numbers. So like I shared earlier, 1 in 3 women die of disease, and only 1 in 8 Hispanic women say their doctor has a woman died.
Allie, you're picking up.
Oh, sorry, it's internet. Now?
You're kind of in and out for me. I don't know about anybody else.
Any better now?
Yes, I can.
Okay. Okay, I'm sorry. It's probably my Wi-Fi with the rain. It's been not great lately. So let me know if it happens again, and I can try to call in from my phone. So a woman dies from heart disease every 80 seconds in this country. 90% of women have 1 or more risk factors for heart disease or stroke. And in terms of percentages of women knowing about heart disease being their greatest health risk, only 34 to 36% of Hispanic and African American women know that heart disease is their greatest health risk versus 65% of Caucasian women. And we know that 80% of heart disease and stroke events may be prevented by lifestyle education and changes. So this is how the American Heart Association has made a priority in reducing risk for women. So just to reiterate some of the information that I shared, the price of being a woman is high. 1 in 3 women will pay that price with their lives when it comes to cardiovascular disease. And we know that too many women remain unaware that cardiovascular disease is their leading cause of death. We also know that women are far less likely than men to receive bystander CPR and continue to face inequities in access to and quality of care. And we know that if we don't address this issue, the simple fact of being a woman will continue to be a risk factor for dying from cardiovascular disease. So here at the American Heart Association, we have identified reducing risk in women as one of our key priority areas as we drive equitable health in local communities. So we are working to increase awareness and help women take charge of their health by working to close gender and ethnicity gaps in research and STEM fields. Our brand, our science, and our grassroots network uniquely positions us to address these inequities that women experience in access to and quality of care. And we also are implementing community-driven solutions to eliminate disparities in calling 911, rate of response, and bystander CPR. So to give you a greater picture how we are driving equitable health, not just for women, but for everybody, we have identified 5 key priority areas here in Greater Phoenix and beyond that we work on to drive equitable health. So, of course, reducing risk in women. We also have our Go Red for Women campaign, and February is American Heart Month with a focus on reducing risk in women. knowing that COVID is a top healthcare priority right now. And we also know that 40% of COVID-19 hospitalizations are from heart and stroke patients. We have fast-tracked millions of dollars into research and response. And we also launched a Don't Die of Doubt campaign, which focuses on encouraging people to call 911 or go to the emergency room if they're experiencing the signs of a heart attack or stroke. It's still the safest place to be. We focus on community action, specifically surrounding tobacco and vaping. So working on education and advocacy, especially with our youth. We know that 1 in 5 Arizona teens are now using e-cigarettes, and it's reaching epidemic levels across the country once again because of these new tobacco and vaping products, especially with all the hundreds of flavors that they offer. So we're really working to advocate to our policy and lawmakers to really enact control. Patients that have chronic conditions, high blood pressure, heart and stroke patients, diabetes, to make sure they have quality care. And of course, you know, the bedrock of everything is focusing on healthy living. So making sure everyone has equal access to food security, and also making sure we put in an effort on our mental health, and focus on it, because we know that mental health and physical health are completely tied. And a lot of people don't realize that. So we really have been trying to work, especially with the pandemic and social distancing and everyone staying home, to make sure we're building mental resilience as well. And of course, equity is always at the center of all the work, and it guides everything that we do here at the American Heart Association. So I just wanted to share with all of you some of the work that we did here in Greater Phoenix. So we trained last year more than nearly 26,000 Phoenix students and community members on hands-only CPR. This can save lives. We know that nearly 400,000 Phoenix and Tempe heart and stroke patients received a higher quality of care because of our hospital partners that have adopted our Get With The Guidelines programs that provides treatment guides and plans on how to treat our heart and stroke patients. We advocated for health through advocating to our lawmakers, specifically around tobacco. And we also invest in our youth. So more than 93,000 students in the past year learned about healthy eating and physical activity through our school-based education programs. We know that obesity rates have tripled over the past few decades. And so we know that this is educating them on physical activity and healthy eating is more important than ever. We also fund research here in Phoenix. We have more than $1.6 million funded right now in active research grants at the University of Arizona College of Medicine here in Phoenix, and also at Phoenix Children's Hospital. I also love to share this information with everybody at all the presentations that I do. It's free resources that we provide to you called Life Simple 7, and it's really just 7 simple ways you can take control of your health. We actually have a website. It's called heart.org/mylifecheck. That'll give you tips and tricks on these 7 simple ways you can take control of your health. You can also upload your health numbers and really just take that first step in helping your own health and leading a heart healthy lifestyle. And so with that, knowing that the importance of the work that we are doing, we couldn't do it without the support of our donors and our volunteers and supporters. And one of the ways that we do this is through the Phoenix Heart Walk. This year, the Heart Walk will be a digital experience, and it is on Saturday, March 13th, 2021. We are asking everyone to get out and walk 3 miles wherever you are. So at your favorite hiking trail or around your neighborhood with your family, take your dog for a long walk. We are excited to see everyone out and walking 3 miles on that day. We are hosting a Move More Activity Challenge in February to encourage everyone to get out and get physical activity. We have a week of wellness and our digital experience guide. And we have so many fun upgraded digital platforms to help engage you from now until our walk day on Saturday, March 13th. So there are a few ways to participate. The Mesa Chamber actually has a team. Sally is the leader. You'll see Linda on there as well, supporting our cause. And I don't know, Sally, if you want to say anything about the team that you're leading and invite everyone to join.
Absolutely. We would love everyone to either be part of the chamber team or start your own team under the chamber's umbrella. And I will follow up this call with some information about that. Jan, I'm counting on you to have a team or at least be part of our team. And you know, it's virtual, right? So you get to do it on your own time. And I think Linda and I will be walking together. So if anybody wants to actually walk with us or, you know, get a small group together, that would be great too. But, you know, I hear so many stories. I know my own family health history, and I just, you know, we can't keep putting things off to, you know, take better care of ourselves. I'm guessing that everybody on this call probably has some connection to, you know, some kind of heart issues, or you have your own, you know, issues that could lead to something bigger. So we're just, I don't know. We decided last year we were going to start taking things seriously at the chamber as far as the staff. And I think kicking off the year with a walk like this makes sense. So we, you know, we hope that you can join us in one fashion or another. I think it'll be fun. It's obviously a great cause. So Allie, we just appreciate the opportunity to do it.
Yes, well, I just want to thank you for your leadership in this. You and Linda and everyone at the chamber has been so amazing in helping us spread the mission of, you know, heart health and the work that we do, and inviting everyone to join. So thank you. And yeah, so as Sally said, you can join the Mesa Chamber team. You can chamber page. You can your business, your company, you yourself, and your family can join. If you want to take that next step, we can also have you join as a business or company and set up your own landing page. And you can work hand in hand alongside us here at the American Heart Association Greater Phoenix to engage your family, friends, employees, coworkers in this really fun event. And we have really fun and exciting things planned between now and then. I'll share information on Rally Day and National Wear Red Day in a moment. But we also have Heart Walk Wednesdays, and we'll send out weekly information to you to share with everyone that you want surrounding Heart Walk and heart health, specifically around physical activity. That's a really big focus that we have right now. We'll also work with you to host a pep rally celebration the week of the event. And of course, our walk day on Saturday, March 13th. And we provide all the tools and resources that you need to be successful. And most importantly, have fun, of course. So I'm inviting all of you today to join us for our Heart Walk Rally Day. If you're interested in learning more about what participating in Heart Walk means, why it's important, we're inviting all of our company partners, all of our community members to join us on Friday, February 5th. So it's actually National Wear Red Day. So we invite everyone to wear red that day and really promote your own heart health, especially as a woman right now, knowing the risks involved. So we'll be hosting a Zoom prep rally the morning of Friday, February 5th from 8:30 to 9. I'll ask Sally if she can share this invitation with everyone after the call. Really just join to learn more, learn to how you can participate, the different ways we have available. And I just wanted to put a plug in here for National Wear Red Day on Friday, February 5th. Heart Month, the month of February, is a month that we are taking to really make sure women know their risks of heart disease, cardiovascular disease, and for everyone to take a step in the right direction in terms of their heart health. Our tagline this year is "One is too many." Losing even one woman is not an option to us anymore. And so we invite everyone to wear red on February 5th to take Heart Month and support the local Heart Walk. And yeah, I have a short video to share, and then that'll be the end of my presentation here. So I'm just going to play it.
Allie, is there supposed to be sound with it?
Can you not hear it? Can you hear it?
I don't. No, I see shaking heads.
I wonder how, do you know how
If you want to send me that link when I send out the
Okay.
follow-up, I can send the video to you.
Definitely. Yeah, so we'll do that. It's just a really short, powerful video on living fierce and taking control of your health, and getting started on that in the month of February. So
Great.
please do watch it. So thank you, everybody. Appreciate you giving me the time today. I hope that I've inspired some of you to take control of your health, to support the work that the American Heart Association is doing. And we would love to see all of you in our Phoenix Heart Walk. And I'd be happy to answer any questions that you have and surrounding Heart Walk or the work we're doing, or maybe you need some resources. So I'll pop my information into the chat box, but thank you so much.
Thank you, Allie. I know I'm definitely in. I'm going to try to convince Gateway Bank here to join and get a landing page. So Allie, we'll have to connect.
Definitely.
Yes. A lot of great information. Thank you again so much, Allie. We were blessed to have you today. For all of you, thank you so much for joining us today. I don't know if we have time. Sally, do you want to do little commercials real quick and intros, or?
Yeah, we have time.
Okay. So why don't we go around the screen really quick and just do some brief introductions, maybe tell us your name, your company, and a tagline of what you guys do. So do we have a list, or should I just go around the screen?
I would just go around.
Okay, let's start with you, Mary. You're right to my right.
Happy Tuesday, ladies. I am your Avon lady. I help you be the best and beautiful you that you can be from the inside out.
Hannah?
Good morning, everybody. Well, afternoon. My name is Hannah Bashaw. I am with CFC, Creative Furniture Connection, and we represent two commercial furniture manufacturers. And we're here to help give creative solutions and innovative modular furniture to your home office, to your corporate office, to really any space.
Thanks, Hannah. Laura?
Hi, everybody. Good to.
Which
Oh,
Laura?
sorry. Laura Motz.
Moats, Lauren, Moats.
Laura Motz.
Everybody.
Sorry. Hi.
I'm Laura Moats. I'm Director of Sales for Courtyard at Phoenix Mesa Gateway Airport, and we are located at the southeast corner of Power Road, right on the north entrance to the airport. And we are having Valentine's Day specials. So if you want to get a nice discount, contact me. I'll set up a nice package for you that weekend. Thanks.
If you haven't been there, it's awesome. Go check it out. Laura Rice.
Hi there. I'm Laura. I work at Aurora Behavioral Health. I'm one of the community liaisons working in the East Valley. So that includes Mesa all the way down though into the southern area of the state. I focus on a lot of the EAP programs as well as the East Valley schools.
Awesome. Thank you. Alyssa Padilla.
Hi, my name is Alyssa and I'm an intern here over at the Mesa Chamber. I'm over here every Tuesday with them. I love it here and I love sitting in on your guys' Zoom call. I've been waiting so long to be here in the Women in Business Zoom call. So thank you very much. I really appreciate you guys letting me in here.
Thanks, Alyssa. Melissa.
Hi, I'm Melissa Buxton and I represent Superstition Spring Center, but I quickly wanted to share that our sister center, Scottsdale Fashion Square, is teaming up with the American Heart Association for a special shopping event February 5th through 14th. So I'll try to get some more information on that. I don't know, Allie, if you're maybe part of that team, but for a small fee, some of our retailers at Scottsdale are providing a shopping discount for a couple of days in February.
Yes, thank you for plugging that. Yes, they are. I'm super excited. They've been great supporters for a long time. So I can send some information to Sally about that.
That's great. Jane, you're up next.
Hi, I'm Jane Cooper. I'm with Aspen Hospice, small hospice, big heart, and we'd love to be able to provide support to anybody in need. Thank you.
The amazing Miss Jan Newton.
Oh, thank you. Well, since I've already spoken, Jan Newton, Nothing Bundt Cakes, bring the joy.
And our friend Peggy, Miss Peggy Lawson.
Hi, everybody. I'm Peggy Lawson with the Market Builder. We do all types of marketing.
All right, we're gonna skip to Jan, Miss Jan Vitale. Jan, we can't hear ya.
Here I go.
There you go.
Jan here representing Fuller Chiropractic. With next month, middle of the month being Valentine's Day, good time to get not only the goodies, but also get your body in shape. So give Dr. Tekla a call at Fuller Chiropractic and she'll give you a good adjustment. And, have my best to all of you.
Thanks, Jan. Let's go to Elizabeth.
Happy Tuesday, everyone. I am Elizabeth Irizarry. I am with Payroll Control Systems, Human Capital Management. We help business owners navigate the craziness of having employees and payroll, and especially with this PPP loan programs, we keep you on point.
Thank you. Gina Lucas. Ginia, sorry.
Yeah, that's okay. I get that all the time.
I know who you are, but I just totally mispronounced it. I apologize.
Yeah, I always figure if you can't pronounce it, just say Jen, and then that's easy enough. So I'm Jenny Lucas from Festive Events and Rentals. We're a full service party and wedding rental company and floral design studio. We do fresh and silk flowers. Right now we're running a sweetheart table special for Valentine's Day. If you want to come and, or if you know anybody where they might want to like surprise their sweetheart and pick up a table, some chairs, and the full setup with a centerpiece, a candlelight centerpiece, where they could go out someplace and have a little romantic evening on their own. We've got a special on that this month. And we are, I'm currently home quarantining. So luckily I have no symptoms, but I'll be out of the office for the next week at least. But there is somebody there on and off, or you can call my cell phone, which I put in the chat if you guys need anything. And, but that's about it. So if you're gonna party, you might as well make it festive.
Thanks, Ginia. All right, let's go to Kristen. Is it Hoppy or Hop or?
Well, it's Hoppy. Do you know why?
Okay. Why?
Because I'm happy to meet you all.
Oh,
I'm happy.
Good one.
Yeah.
Clever.
My name is Kristen. I'm a manager for the wonderful Jan Newton at Nothing Bun Cakes. Your one-stop shop for all friends, families, neighbors, and even strangers. We make a lot of friends with our cake. Just bring them, drop them off at a business, make somebody's day, spread the joy.
Great, thank you. I think it's the raspberry chocolate chip is my jam, Jan. I just can't get enough of that little buntlet. All right, let's hop over to Kristen Harvey.
Hi, everyone. I'm Kristen Harvey. I'm with Jewish Family and Children's Services East Valley Healthcare Center. We're located at Arizona Ave in Guadalupe, and we provide both behavioral health services and primary care services under one roof.
Thanks, Kristen. All right, Becky Friend. Becky with us? We'll go back to Becky. Let's go on to Connie with Use My Guy Services.
Good afternoon, ladies. Connie with Use My Guy Services, transforming your shower in as little as a day.
Thanks, Connie. All right, next we've got Vanny. Did I pronounce that right?
Yes, that's right.
Okay.
Hi, I'm Manny Wong. I'm pretty new to Mesa Chamber, so it's pretty fun to listen to everybody talking because I think it's my first meeting with this group. I own multiple business, but the one that actually I'm very interested in for working on right now is called Gilda Monster Printing. We are printing from business card to banner to blueprint for anything and greeting cards. So Valentine's Day coming up, you want any special individual custom Valentine's Day card, please come see me.
Thank you, Vanny, and welcome to the Mesa Chamber. We're glad you were able to join us today. All right, Jennifer, you're up next.
Hi, first I want to say, Mary, I love your background. I need to get a heart background. Jennifer, Fairway Independent Mortgage, where we focus on any kind of mortgages for primary residence on a second home investment property. Inventory is very low right now, which you might know, but there are still some houses out there to buy. So I also do reverse mortgages. So if you just want to even find out what that is and the truth of what that is, just give me a call. I'd love to talk to you. Thank you.
Awesome. Thanks, Jennifer. All right, Susan.
There more than one? Oh, which one?
Susan.
No, you go ahead.
Stevenson.
Stevenson. Okay, that's me.
Stevenson, sorry.
No, that's okay. Good to have another Susan on the line here. I'm Susan Stevenson, and I work in government affairs at ASU, and I work in the East Valley, so work with Mesa. So the good thing I want to make sure is that if you didn't hear our wonderful announcement yesterday, the name of our film school that's downtown Mesa is the Sidney Poitier New American Film School. So it's really, really exciting to see that. There was I think you can still look at the link that's out there and watch the interview, and his kids were all talking and excited about the school named after their dad. So we're excited to have that in downtown Mesa.
That's awesome. All right, thanks, Susan. We're going to move on to Erica. Erica Emmons.
Hi, I'm Erica Emmons. I am with Cigna. I manage our government business here in Arizona, but I'm also a member of the Mesa Chamber Board. And then Cigna obviously has a huge stake in heart health and a huge interest in the health of, our customers and our communities. I know our market president, Kim Shepard, has participated and done many challenges with the American Heart Association over the years. So thank you for your presentation today.
All right, and Kristen Eisenberg.
Hello. Yes, I'm Kristen. I'm the Human Resources Manager with Trivicity Health Corps. We manufacture the N95 respirator masks. We are selling to individuals and businesses. And you can go to the n95shop.com, and I'll put that in the chat. But again, we manufacture the respirators locally. So very, very glad to be with this company, bringing jobs and USA made products.
Awesome.
Thank you.
Thank you. Thanks for sharing. Becky, are you on? Becky, friend? I'm going to loop back to you. All right, so now we're going to go to some of our amazing chamber staff. Susan, let's start with you.
Had to unmute. I'm Susan Teichman, Director of Membership Sales for the Mesa Chamber. I want to say it's great to see all of you. And if any of you know anybody who would like to join the chamber, please let me know and I'll reach out. Thank you.
Shauna.
Hi, everyone. Shauna Zuniga, Mesa Chamber of Commerce. I'm the Director of Operations and Finance, and be happy to answer any questions or questions on your invoices or any questions in general. Thank you for having me today.
Thanks, Shauna. Linda, Miss Linda.
Hello, everyone. So good to see you. I am Linda Haskell, Director of Membership Services. I am here to help you with your membership and lend support in any way. So please feel free to give me a call. I'll put my number in the chat. Thank you.
Awesome. And Sandy, did we miss you? I think I did. Oh, I can't hear you.
You're on mute, Sandy.
Okay, now?
Yes.
Yeah, can you hear me now?
Yes.
I don't know what happened. I was just listening to you guys and all of a sudden my screen just went blank, and then I told Sally I got thrown off. She said, come back on. So anyway, I'm Sandy with Mesa United Way, Director of Small Business. I run the United 365 program for small businesses who cannot do a campaign through Mesa United Way for $365 for the year. That is your United Way campaign. And there is a lot more to it, but just let me know. And I put my information in the chat.
Thanks, Sandy. All right. And I am Lauren Leverett. I am a business development officer at Gateway Bank. Gateway is your local community bank in Mesa. In fact, your only community bank in Mesa. We specialize in commercial lending, but we are an overall bank. We service all clients. So we'd love to help you out if you have any needs. Also, if you have any PPP questions, send them my way. I can try to direct you or help you out. So let me know. All right. So did I miss anybody? Are we good?
You might have missed Teresa, and I'm not sure about anybody else. I think you got everyone else.
Teresa, we miss you?
Yeah.
Sorry about that. Sorry, Teresa, I didn't see your face.
That's okay. I'm Teresa DeBona, the administrative assistant with the Mesa Chamber, and I'm here to help you with anything that you need. And I'm back in the office full time, Monday through Thursday. So if you need anything, I'm here. Just give me a call.
Thanks, Chief. She's the one that keeps things running.
Right. Thanks, Teresa. She knows everything and everyone. So if you ever have questions, that's your lady to call for sure. Okay, so we're going to go ahead and wrap it up a little bit here with some announcements from the chamber. Here's some upcoming events, just so you guys are in the know. You can register for these events at the Mesa Chamber website. But we've got the virtual coffee time on Thursday, January 28th from 8 to 9 a.m. We have the Good News Girlfriends Club, which is kind of an extension of this group. So we'd love for you guys to pop on and join us for that. It's Fridays from 3 to 4. So this Friday from 3 to 4. We also have the Zoom Mesa Takeout Virtual Lunch Mob. So that's Thursday, February 2nd from 11:30 to 12:30. The Aging and Healthcare Committee is meeting on February 4th, which is a Thursday, and that's from 8 to 9 a.m. We'd love for you guys to jump on that one as well. And the Good News Girlfriends Club again the next Friday. So every Friday from 3 to 4, we'd love for you guys to join us. One last thing I want to mention is, last but not least, is our golf tournament that's coming up. So it's the 2021 Mesa Chamber Annual Golf Tournament. It is on April 15th. We would love your guys' support with that. You can register on the chamber website for that. It's going to be at Alta Mesa Golf Club, which is the new location, but we'd love for you guys to support that event. It's a 12 p.m. Box lunch and registration, 1 p.m. shotgun. So it's in the afternoon. There's also opportunity for you guys to sponsor. There's different sponsorship levels for that. Sally, do you want to say anything about that in particular?
It will be fun. It will be fun, but it will be a really fun time. It's a new course for us. It's a private course, so we were lucky enough to have a friend of a friend who lives there get us on that course. It'll be different, obviously, but we're looking forward to it.
Yeah.
Yeah. Before we totally wrap up, Jan, remind everybody we have a couple of prizes. Tell us about it.
Yep, so these are Buntlet a month for a year cards. So you just bring your card in, you get a Buntlet, and go home and have a heyday with that thing.
Okay, so I was at the office earlier this morning and I drew, and I've already thrown out the people who did not show up. So you can let a couple people know that you know, they didn't win because they weren't here. And I'm sorry, Kristen, but you get bundt cakes as much as you want, I'm guessing. So I tossed your name too. So better luck next month with a different prize. But the two people that got drawn out of the 6 I drew that are here, Erica Emmons, you'll have to check in with Jan because you are a winner. And Jane, are you still on the call, Jane Cooper? Yes, you are. There you go. Hey, ladies. And Jan, thank you so much for the prizes. We appreciate that.
You're welcome. And those coupons will be in the store with your names on them, ready to go with a complimentary Bring the Joy mug.
Woo! A mug. Awesome.
Yeah.
Awesome. Thank you, Jan. Congratulations, Erica. Congratulations, Jane.
Oh, I feel a road trip coming on.
Congratulations.
Very cool. All right, Lauren, anything else?
That's it. Just have a great day. Thank you.
Well, thank you again, Jan, for being our sponsor. And Allie, thank you so much for the information. You guys watch for an email from me because we are going to follow up with some more information about the Heart Walk. We'd love to have you all join us. It's good to see all of you ladies, and please have a great day, make it safe, and we'll see you next month on this call. Hopefully between now and then, we'll see you on some other calls.